Have you ever considered what your toes might be telling you about your health? It may seem unusual, but your toes can offer intriguing insights into your overall well-being. From the length of your toes to the health of your toenails, each aspect could be hinting at something deeper. Curious? It's fascinating how these small parts of our body can reflect our health in significant ways. So let's embark on this journey of discovery together. Stay tuned to find out how toes can be a window into your health. Believe it or not, the length of your toes can indicate certain health risks. While it may sound surprising, our toes are more than just appendages that help us balance and walk. They carry secrets about our health, and decoding these can be as simple as observing their length. Medical research has found intriguing correlations between toe length and various health conditions. For instance, a study suggests that a longer second toe is linked to a higher risk of heart disease. Meanwhile, a shorter big toe could signify potential issues with blood sugar control, hinting at diabetes. It's not about panicking at the sight of a long second toe or a short big toe, but rather, it's about awareness. These subtle signs can guide us towards a healthier lifestyle or prompt us to seek medical advice earlier. So, next time you take off your shoes, take a moment to examine the length of your toes. Your toenails can be a powerful predictor of your health. This may come as a surprise to some, but it's absolutely true. Toenails are not just there to be painted or clipped, they can provide key insights into your overall health. Let's start with color. Healthy toenails are usually a clear, slightly pinkish hue. If your toenails start to change color, it might be a sign of something going on. For instance, a yellow discoloration could indicate a fungal infection. While this might not sound too serious, if left untreated, it can lead to more severe problems like pain and difficulty walking. Now, let's talk about texture. Our toenails should be smooth and hard. If they become brittle or start to crack, it could be a sign of an iron deficiency or a thyroid problem. On the other hand, if your nails become thick and hard, it might be due to poor circulation, often associated with diabetes or peripheral vascular disease. Another thing to watch out for is the growth of your toenails. Normally, toenails grow about 1 millimeter per month. If you notice a sudden change in the speed of your toenail growth, it could be an indication of an underlying health issue. Slower growth could be a sign of poor circulation or a nutritional deficiency, while faster growth could be a sign of an overactive thyroid. And let's not forget about the shape of your toenails. If they start to curve inward, it could be a sign of an ingrown toenail, which can be painful and, if not treated, can lead to an infection. If your toenails begin to curve upward and become spoon-shaped, it might be a sign of an iron deficiency or a more serious condition like heart disease. So, as you can see, there's a lot more to toenails than meets the eye. They can be a window into your health, providing early warning signs of potential health issues. Remember, healthy toenails are usually smooth and consistent in color. Any significant changes could be a sign of a health problem. The sensation in your toes can also reveal a lot about your health. Now let's delve into this a bit further. Imagine walking barefoot on a sandy beach. The warm grains of sand tickling your toes, the cool waves lapping over your feet. You feel all of this because of the nerve endings in your feet. But what happens when these sensations start to fade or perhaps become uncomfortably persistent? Reduced sensation or numbness in the toes isn't something to brush off. In fact, it can be a symptom of conditions like diabetes or nerve damage. Diabetes in particular can lead to peripheral neuropathy, a condition where the nerves in your feet become damaged, leading to numbness, tingling, or even pain. Now, let's flip the coin. Persistent pain in your toes is also a red flag. It could indicate problems like arthritis or gout. Arthritis can cause inflammation and swelling in the joints of your toes, leading to discomfort and difficulty in movement. Gout, on the other hand, is a type of arthritis that usually affects the big toe, causing intense pain and redness. So it's clear that your toes are more than just the end point of your feet. They're like little health detectives, giving you clues about what might be going on inside your body. Don't ignore any unusual feelings or pain in your toes. They might be trying to tell you something important about your health. So, what have we learned about what our toes can tell us about our health? It turns out, quite a lot. Our toes, often overlooked, are actually quite telling about our overall health. They are like little health barometers, giving us clues about what might be going on inside our bodies. The first main point we covered was about toe length. It's fascinating how the length of our toes can potentially indicate certain health conditions. For instance, a longer second toe might suggest a heightened risk of cardiovascular disease, while shorter toes could point towards issues with balance or coordination. This doesn't mean you should panic if your second toe is longer than your big toe. But it's a good reminder that our bodies are interconnected in ways we might not always consider. Next, we delved into toenail health, which is a rich source of information about our well-being. Changes in color, shape, or texture of your toenails may be subtle signs of nutritional deficiencies, infections, or even systemic diseases. Yellow toenails, for example, might indicate a fungal infection, while spoon-shaped nails could suggest an iron deficiency. It's important to regularly check your toenails and consult with a healthcare provider if you notice any changes. We also shed light on the importance of foot sensation. Numbness, tingling, or pain in the feet can be early symptoms of conditions like diabetes or nerve damage. Our feet are home to thousands of nerve endings, and changes in sensation can be a sign that something isn't quite right. Regularly checking in with how your feet feel can help detect potential health issues early on. In conclusion, our toes are more than just appendages at the end of our feet. They're a part of our body's complex system, reflecting our health in surprising ways. So next time you're putting on your socks or sandals, take a moment to check in with your toes. Remember to give your toes the attention they deserve. They might just provide the first clue to a hidden health problem. Stay healthy and keep those toes happy.